knee arthroscopy is basically an operation inside the knee through two very small incisions, one on each side of the kneecap. The incision itself is 1 centimeter, and you usually get 2 incisions. Sometimes we use a third one, but this allows us to get a camera inside the knee. We look at everything inside the knee, including the cartilages, including the menisci, the ligaments, and if there's any pathology, we deal with it through the other portal, through which we put the instruments in. The knee arthroscopy can actually treat many conditions of the knee, including meniscal injury, ACL injury, PCL injury, the cartilage regenerations. All of these conditions can be treated using the keyhole surgery or the knee arthroscopy. But the majority of the cases are dealt by them in the keyhole surgery are dealt within the degenerative meniscal injury secondary to the joint arthritis. Of course, yes, the treatment takes place immediately after the diagnosis has been made. Basically, what I usually do is I get the camera inside the knee. I look very quickly on all the structures inside the knee, and I have made up the diagnosis, which also reflects the scan that we have done prior to the surgery. And then we deal with the pathology that does exist, including the meniscal degenerative tear that we usually excise. The keyhole surgery of the knee or the arthroscopy of the knee does carry risks that is very minimal happening in the practice, including infection, pain, some stiffness, and very, very unlikely a clot can happen in the leg. However, the benefit of the surgery is massive. It's a very minimally invasive surgery. It's done through two keyhole surgery. It allows the patient to go home in the same day. It allows all the activity to occur within 2 weeks. The client or the patient usually back to their work within 2 weeks of the surgery. The knee arthroscopy involves operating on a knee through two very small incisions, where each is 1 centimeter on each side of the kneecap. One of them allows the instruments to go in, and the other one allows the camera to go inside the knee. The knee operation itself usually doesn't take too long. It's between 20 minutes to maximum of 45 minutes, depends on the pathology that we find inside the knee. The recovery from it is immediate. The patient go home in the same day. Maybe the dressing is removed the next day. Patient is allowed walking immediately after the operation. We recommend just minimal activity during the first 2 weeks to allow the wound to heal with no complication, in particular the infection. And then the patient is free to do all the exercises from day one, and the strengthening exercises from the second week.